Hello, friends. So, welcome to this session of a live interaction, and we are meeting on the occasion of the World Down Syndrome Day. The purpose of me coming live to you here is to make you aware of what is this condition, Down syndrome, what are the common tests available for pregnant women who want to screen for this condition, what are the tests available to diagnose this condition, and should you have a diagnosis of this condition, then how can you take things forward. So I would encourage all of you to ask me questions if you have any, to give your inputs if you have any, so that we can have a very interactive session. So I am Dr. Chinmayee Ratha. I'm a fetal medicine doctor practicing in Hyderabad, which is in the south of India. And I deal with patients who are pregnant and who come to us for routine screening and diagnosis of fetal conditions. So, screening for Down syndrome has been a very important part of fetal care. And there are some important landmark points in pregnancy when one looks for this condition. And I thought today was a very good occasion for all of us to revise this. So when you get pregnant, you form a fetus which contains the chromosomes and genetic material both from the father and the mother. So when a genetically normal person, a person who has normal number of chromosomes, and do you know what is the normal number of chromosomes that human beings have? I don't know how this can be interactive, but I would try to see that if anyone is listening to me can answer on the chat box that do you know how many chromosomes does a normal human being have? So if I give you a choice of say 10, 20, 23, 46, 84, what would you answer? 10, 23, 46, 84. What is the correct number? Anyone can answer. You don't have to be a doctor to answer this. Anyone can answer. I have an answer saying 23. And 23 is the number of chromosome pairs that we have. So we do have 23 chromosomes, but we have them in pairs, and therefore we have a total of 46 chromosomes. So as human beings, every cell of our body has 46 chromosomes. And when we form a gamete is the cell which is carrying the genetic material that will transfer to the next generation. So, forming an egg or a sperm is the process of gametogenesis, and the gamete is either an egg or a sperm. So, the egg or a sperm contains only 23 chromosomes because the normal component of 46 undergoes a reduction division, and then the gamete has only 23 chromosomes. So you get 23 from the mother, 23 from the father, and you form 46 chromosomes again in the embryo. So a normal embryo, a normal fetus is supposed to carry 46 chromosomes. In some cases, that breaking of the 46 into 23 does not happen correctly. And the reason for this is usually non-disjunction. The word is a long word and it sometimes confuses people, but non-disjunction at the time of meiosis. Meiosis is the reduction division when a cell of a body divides into gametes and forms half the component of chromosomes in each cell. So in the reduction division, the reduction is not perfect, and therefore 23 is not the outcome, but it is 22, 24. So the resultant gamete may have a chromosome more or a chromosome less. In such a condition, if the gamete has one chromosome more, then it becomes 47 chromosomes in the resultant fetus. And Down syndrome is one such condition which is caused by trisomy 21. So the 21st chromosome has three copies instead of two. So that is why it is known as trisomy 21. The resultant condition is known as Down syndrome because it was described for the first time in 1800s by a scientist known as Sir Langdon Down. So in commemoration of his classification of these group of individuals who were later found to have that extra chromosome number 21, this condition is known as Down syndrome. That is why we use the word Down. It is not that anything is low or high or anything, but the surname of the scientist who discovered this condition was Sir Langdon Down, and therefore this is known as Down syndrome. So you would wonder how many people can have Down syndrome. So in a normal population, just by chance, about 1 in 700 to 1 in 800 people could have Down syndrome just by chance. So in a time when there was no screening test for Down syndrome, when there was no prenatal intervention for fetuses with Down syndrome, the incidence of Down syndrome was 1 in 700 to 1 in 800. Over the last 3, 4, 5 decades, the screening for Down syndrome has become very, very sturdy, and people have started opting for getting this information early. And in many cases, people do not want to continue the pregnancy if it's already diagnosed with Down syndrome. So the live birth rate for Down syndrome has reduced to 1 in 1000 to 1 in 1200. The Indian Academy of Pediatrics gave the numbers that in recent times the live birth rate for Down syndrome is 1 in 1000 to 1 in 1200, because there has been prenatal diagnosis and sometimes termination of pregnancy, and also because some of these babies have structural malformations and may not make it to the end of pregnancy. So the incidence in population today is 1 in 1000. However, who can have Down syndrome? So technically, any pregnant woman can have a baby with Down syndrome because this is possible by just a random mistake in the process of forming a gamete. If we want to know who is at high risk of having Down syndrome, then we have to have a screening test. In the last century, we used to think any woman above the age of 35 is at high risk. That is a fact. But then a woman below the age of 35 cannot have Down syndrome. That is also not true. And therefore, we have to have a screening policy which is uniformly applied to everybody. And in today's day and age, we give women this option in the first trimester of pregnancy. So if any one of you have any particular question regarding the screening test, regarding what are the options to screen or what are the tests that should be given to any pregnant woman, I would like to hear from you directly first. And if I don't get any specific question, then I will give you what I have in my mind. So I am looking for an area where I can see your questions. Do we have any questions from the audience? So, if you ask me who is particularly at high risk of Down syndrome, like I told you, every pregnant woman has a risk, but this background risk is dependent on the age of the mother. So it's a very common statement that we make in normal conversations that, you should not delay your pregnancy a lot because you will have babies with problems as you age. So it is a fact that the risk of chromosome abnormalities increases as the mother's age increases. But at any age, it is not zero. So 35 years used to be considered as a watershed point. And when these textbooks were written, when these discussions were happening, the social fabric was also different. So women were completing their childbearing between 25 to 35. And therefore, anybody who was 35 led to a lot of raised eyebrows. And it was like, oh, that's a very advanced maternal age. However, in today's day and age, we see women who delay childbearing because they are still not done with their, you know, uh, career challenges and other things. So it's not unknown for women above 35 to get pregnant, and hence this anxiety is too much. But let me tell you that the anxiety should be too much for anyone who's pregnant, because this condition can happen to anyone. So, how do we screen? We use screening methods which can be applied on every pregnant woman, and then they help in classifying women as high risk or low risk for Down syndrome. So one of the common tests that we offer women in the first trimester, that is the first 3 months of pregnancy, is called a nuchal translucency scan, which is done between 11 to 14 weeks of pregnancy. And this is again, sort of complemented by a blood test, which is traditionally known as the double marker test. So, a scan, which is called the nuchal translucency scan, and a blood test, which is known as the double marker test, will help us in providing a combined first trimester risk assessment for Down syndrome. So, a lot of you who are pregnant and have gone to your obstetricians and gynecologists in the first 3 months of pregnancy would have been told that this is a very important scan. So, indeed, in today's day and age, it does not make sense to miss that scan. And that scan is done between 11 and 14 weeks of pregnancy. It is a very useful time because the baby is being formed. So you can see the head of the baby, you can see the hands and legs of the baby, you can see the spine, you can see structures in the abdomen like the stomach, the bladder, the kidneys, and you can also see the heart, the four chambers of the heart, and the basic structure of the developing brain, face. So many abnormalities in the structure can be picked up. Some abnormalities are typically problems that increase the risk of Down syndrome. And since today we are discussing Down syndrome, then I would like to tell you about those abnormalities. So they are nothing but absent nasal bone, or increased nuchal translucency, or regurgitation in the tricuspid valve flows, or atrioventricular septal defect in the fetal brain, or an abnormality in the ductus blood flow. So I believe there is some question that has come up, and the question says, what causes Down syndrome and how is it diagnosed? So I believe you've joined us a little later than what we started this discussion as. So the Down syndrome, as I'm just going back to the discussion a little bit because of this question, and Down syndrome is a chromosomal abnormality, and it is caused by having an extra chromosome number 21. As human beings, we discussed that we have 23 pairs of chromosomes, which means 46 chromosomes, but people with Down syndrome have 47 chromosomes, and that extra chromosome comes from different comes from either the father or the mother, most likely the mother, and this comes because of a defect in the formation of the gamete. So one extra chromosome is passed on from a parent to the child, and it is diagnosed. The diagnosis is by checking the chromosomes of the fetus. We'll come to that. Right now we were discussing the screening tests. So every woman who gets pregnant and she goes to her obstetrician and gynecologist in the first 3 months of pregnancy, she is told that let us have a screening test. And that screening test is nothing but a ultrasound scan of the fetus, which is called nuchal translucency scan. So nuchal translucency is the fluid behind the neck under the skin of the baby in the first trimester of pregnancy. And this is high in cases which are at high risk of having chromosomal abnormalities. It is high for many other reasons also, but chromosome abnormality is an important reason of increased NT. So, if the child has increased nuchal translucency, if the nasal bone of the child is not seen in the first 3 months of pregnancy, if the valve that takes the blood from the right atrium to the right ventricle has leak across it, or if there is a heart defect like the atrioventricular septal defect, then we suspect Down syndrome. A screening test helps us to suspect Down syndrome. Similarly, blood test is done, which is called the double marker test. There are two markers. These are chemical markers, free beta HCG and PAPA, two chemicals that help us assessing the risk of Down syndrome, because in babies who have Down syndrome, the mothers have high beta HCG and low PAPA. So the lab uses all this information, puts that together, gets to know the maternal age, and then tells us whether or not the baby has a higher risk of having Down syndrome. So, suppose this risk assessment comes out to be low risk, then it's very reassuring. When you get any report and it says low risk, it is very reassuring. But suppose it says there is a high risk for Down syndrome, then you start worrying. But believe me, a screening test can only tell you low risk or high risk. It cannot tell you whether the baby has the problem or does not have the problem. So, even if you are high risk, suppose your report says you are high risk for Down syndrome, do not panic. Meet your doctor. She will probably refer you to the fetal medicine department, which does all these detailed assessments and tells us whether or not the baby has Down syndrome. So, the definitive test for testing for Down syndrome happens by directly testing the baby. So, the doctor can put a needle in the pregnancy sac, collect a sample from the baby or the placenta or the amniotic fluid, and this sample can be sent to the lab and they can count the chromosomes on the cells of the baby and tell us whether there is Down syndrome or no Down syndrome. So, the diagnosis of Down syndrome is done by invasive tests. The screening from Down syndrome is done by ultrasound scans and blood from the mother. Am I clear? Or is there any other question? If there is a question, I would like to answer that. So I find another question there, and this says, what are the physical characteristics of Down syndrome? And also another one, what advice do you have for new parents of a baby with diagnosis? Thank you so much. I am really thankful for people who have joined and are interacting. So, what are the physical characteristics of Down syndrome? So, children with Down syndrome have an unusual kind of face, which is a rounded face with the nose being a little flatter than what other people have. So, what Langdon Down had described, he had explained that the skin of these babies is too large for their bodies, appearing to be overhanging at the edges. So, that is why the neck fold thickness looks bigger. Similarly, the nose is small and the prominence of the profile of the face, like when you see a person by the side profile, there is a prominence that you see of the upper jaw and the lower jaw, and there is a particular profile that you get. In babies with Down syndrome, that face is a bit flat. The eyes of these babies have an unusual fold which is known as an epicanthic fold. So the actual appearance was described as mongoloid earlier because the pictures resembled people from the mongoloid race, but now we don't use that word anymore because of the racial implications and the obvious objection to using that word in an abnormal condition. So we don't use that word there, but what we use is that the features have a less prominent face as well as a epicanthic folds in the eyes. The hands have a typical crease pattern which is known as a simian crease, the palmar simian crease. The legs sometimes have what is known as sandal gap. There's a gap between the big toe and the small toe, but the facial appearance is so unique that it is very unlikely that you will not diagnose it, or you will not suspect it when you see an individual with Down syndrome. The problem in pregnancy is you can't see the person directly. However, you are only looking at the ultrasound picture. So in the ultrasound picture, you will look at the nasal bone. Hypoplastic nasal bone increases the risk of Down syndrome 7 times. You will look at nuchal translucency, and there are a spate of markers. In the first trimester, I already told you nuchal translucency, nasal bone, ductus venosus flows, tricuspid flows, the presence and absence of AVSDs. These all change the risk of Down syndrome. In the second trimester, you have nuchal fold thickness, you have nasal bone, you have short humerus or short femur, echogenic bowel, echogenic focus in the heart, ventriculomegaly in the brain, and sometimes presence of other malformations, for example, atrioventricular septal defect in the heart and duodenal atresia. There is another question here, and I would say that, ma'am, 30-year primi gravida with NT more than 95th centile, rest normal with NB present. What should we do this? Now, the double marker is low risk. So basically, this is a case with increased nuchal translucency. So if your double marker has given you a low risk, maybe this increased nuchal translucency is not because of Down syndrome, but like I told you, these are only screening tests. And when the nuchal translucency is increased, then the risk for Down syndrome also increases, as well as the risk of other problems like unusual genetic syndromes, unusual chromosomal abnormalities, for example, microdeletions, duplications, they also increase. So whenever there is an increased nuchal translucency, the recommendation is to check the fetal chromosomes for all possible problems that can be detected by present day technology. And the standard of test nowadays is the cytogenetic microarray. So if the NT is above 95th centile, we certainly recommend doing a cytogenetic microarray, which will definitely rule out Down syndrome as well as other chromosomal abnormalities. We also recommend doing a detailed fetal echocardiography, because sometimes the findings on the NT scan could be a result of heart defects. So one of the reasons of having increased NT is heart defects, and a detailed echocardiography needs to be done. If echo is normal, chromosomes are normal, then you follow up the baby and see how is the NT behaving. Is it further increasing or is it reducing? So if it is reducing, then probably it is a normal variation, and that's kind of good news. And you follow this baby with growth and echo and serial Dopplers in the third trimester. However, if it is increasing, then either it is part of a chromosome abnormality which gets detected by the test, or it may be an unknown genetic syndrome for which you may have to send for genetic tests. And genetic tests are different from chromosomal tests. So you may have to send for what is known as an exome sequencing in the baby. And otherwise, it can also be a part of a infection related condition like the torch infections, which have transplacental transmission. So increased NT is a complex issue. With regard to Down syndrome, the answer is checking the chromosomes. So a basic QFPCR or cytogenetic microarray will sort out your problem. But with regard to other things, you have to maintain a serial follow-up, preferably in a center which deals with fetal medicine, so that they can objectively counsel the patient and take things forward in a rational way. I think there was one more question regarding what to. I can't see the questions here, so kindly show me. Yeah. Okay, I was not able to see that there. Now I can see the comments, and thank you so much. There are a lot of people who have actually asked questions. So, what would we want to do next? And double marker is low risk. So, Dr. Shalini or Ms. Shalini, I think I have addressed your question. If you still want to ask something else, please do answer. Preeclampsia. Somebody has asked for preeclampsia. Well, the first trimester scan can also screen for preeclampsia because that is done by the uterine artery Doppler at that stage. And in the double marker test, which is used for Down syndrome screening, the advantage is that you can also look at the risk of preeclampsia because one of the markers in the double marker test is the PAP-A, pregnancy associated plasma protein A, and this decreases in cases where we suspect placental dysfunction and increases the risk of preeclampsia and fetal growth restriction. So in the first trimester screening protocol for Down syndrome, you definitely have the opportunity to screen for preeclampsia. There is management of hyperkalemia, which I am really not sure why we are discussing that here, because hyperkalemia is not something typically we look for in the first trimester. I am sorry if I didn't get your question right. And if you could just elaborate on that question, then that would be wonderful. So, yeah, thank you, Shalini. And there was one more question on what would we advise a couple if there has been a diagnosis of Down syndrome on the scan. Yeah. What advice do you have for new parents of a baby diagnosed with Down syndrome? So, that is a very important question because this can happen in two situations. One is you have done that screening test and then you have done a diagnostic test like an amniocentesis or a CVS, chorionic villus sampling CVS, and diagnosed that there is Down syndrome in the fetus. So this is a dilemma. It is a very difficult question to answer for the parents as well as for the obstetricians, because you know that this child will have some special needs after birth. You know that some of these babies could actually do okay. I mean, they will be productive members of society, but you don't know what all complications they could have, because structural malformations can be diagnosed by ultrasound. So if the baby has a major heart defect, if there is a duodenal atresia, if there is some other problem, you can tell them that, you know, these are the structural problems and they need to be operated, and the whatever the results of the surgery, they can talk to the pediatric surgeons and find out. But if there are no problems at all with the baby structurally, then also there is a degree of suboptimal intelligence after birth and predisposition to medical problems like hypothyroidism, childhood cancers. So there is a lot of discussion that has to happen with the parents. And here, I think we just have to be neutral in our thoughts, because as healthcare providers, our job is to give that information to the parents, and the decision to continue or discontinue the pregnancy is totally theirs. So, if somebody decides to discontinue a pregnancy with the diagnosis of Down syndrome because they do not feel that they are up to the responsibility of taking up this whole challenge of managing this baby, then I think it's a choice they have, and we would respect that choice as long as it is within the health wishes of the mother. However, if a baby has been diagnosed with Down syndrome after birth, that means you did not suspect it or you did not diagnose it antenatally, but the baby who's been born has been diagnosed to be of Down syndrome, then the parents immediately feel a little disturbed because now they are told that this is a child with special needs. And the pediatrician, the developmental neurologist, or the developmental physician sits with them and explains to them the entire journey that is expected ahead of us. I already told you the expected complications and the expected problems, and they need to understand where and how they have to rearrange their lifestyle to take care of a child with Down syndrome. So just yesterday, we had an interview with a family who have had a child with Down syndrome, and now she's 20 years old, and they have given a wonderful life to that girl, and she is taken up a lot of sort of hobbies where she does dancing, and she does a lot of activity in the family, where she participates in all the regular day-to-day activities, and also helps her parents in some way or the other. She has very good handwriting and is extremely obedient and a source of love and warmth to her family. Her younger sister is now a medical student. So that example shows how a positive family atmosphere actually provides a good nurturing zone for these kids to grow and make life meaningful for themselves and provide a good atmosphere in the family. Some children with Down syndrome may have some complications, and I think that is what has been written, that what medical tests are recommended for individuals with Down syndrome. So here a neonatologist and the pediatrician will have to come into the picture, and there has to be a very serial follow up of these babies to see their developmental milestones. So checking for their inborn errors of metabolism, checking for hypothyroidism, checking for their blood and the blood picture in their uh, system, that all takes place in addition to their physical milestones and developmental milestones, and a chart is made to serially monitor these as time comes. Some of these babies have hypotonia, so there is drooling of saliva, there is a little difficulty in digestion, some constipation. So for all those things, nowadays physicians have become very alert to these conditions, and they have developed a special unit for taking care of children with these systems. So we have particular pediatricians and physicians who are interested in taking care of these children, and we refer them to that unit where they are serially followed up. The parents also need a lot of guidance, because these children will be a little different from the regular cohort of children, and therefore they need guidance what to expect in the care of these kids, and how to make life easy for themselves as for others. We are very proud of a lot of parents who have handled children with Down syndrome and have been extremely forthright about it, and have sort of come forward and volunteered that if there is another family which is dealing with this situation, we would like to tell them what we went through and how we are dealing with it. So that is what we call as a support group formation. So there is this support groups with parents who have dealt with the situation, and they are volunteering that. So in all hospitals, in all fetal medicine units, we have a cohort of parents who have experienced this and are willing to share their experiences. So we put them through to that group of people, and that provides a lot of support for parents to take on the challenge as things progress. And the regular feedback we get from people is, although initially they do get a little disturbed, it eventually works out, and they feel very happy to have kids with Down syndrome around them. So there is a question that I have, that can Down syndrome be cured with treatment? That's really a very, very sort of touching question, because one would think that medical science can cure everything. But the fact is, medical science cannot cure everything. But a more important fact is, medical science can care for everything. So it is a chromosomal abnormality, and you cannot actually change the chromosomes of a person. So, as science stands today, there is no ultimate cure for Down syndrome. But all the complications that we spoke about can be managed and can be checked. Having said that, there is research that has come up, and they have said that every child with Down syndrome does not have the same type of complications. So there has been research to show some areas of the chromosome 21 which code for certain genes, and if these genes are expressed, then the outcome of Down syndrome is different, and if these genes are not expressed, the outcome is different. For example, we've seen babies with Down syndrome who have structural malformations and can't make it past the first month of life. We have seen people with Down syndrome who are living a normal life, going to schools that have facilities for these children, and reaching up a stage where they can definitely work as a productive member of the society. And a lot of places where it is just about some kind of a repetitive pattern based work, they are actually even getting jobs in those areas, and they are taking care of their families also. So there is a whole wide range of what we call as the phenotype or the expression or the manifestation of this condition, that is Down syndrome. And it depends on multiple factors. Environmental, of course, is one aspect, but how will each person respond and what is the ability that they can reach to depends on the manifestation of some genes in their body. So that research is going on, and the ability to manipulate these genes will come sometime in the future. And if we could deactivate that one chromosome which is extra, then probably the features would be different. So there has been a lot of work done in these lines. As of now, it's a bit experimental. So I would not say we have a total cure for Down syndrome, but there is always a method of caring for people with Down syndrome. And we have definitely achieved a lot in that. And hats off to the parents who have taken care of these kids and formed a very good example for society, so that we can, counsel parents, new parents, as the question says, new parents with Down syndrome, about what the outcome is going to be and how they can make it easy for themselves, for the whole family, because there is a lot of adjustment needed by all family members to deal with a person with special needs. And society should get mature to handle these requirements. So I have a question from Jhansi which says, ma'am, if the sibling is diagnosed with Down syndrome, how do we screen the present pregnancy? Great question, Jhansi. So the thing is, if you have Down syndrome, that means you have one extra chromosome of Down syndrome. And the woman who has one child with Down syndrome has an increased risk of Down syndrome in the next pregnancy. Here, one technical detail I would like to share with you, that although Down syndrome is about one extra chromosome, this extra chromosome can be there in a person in two ways. One is that there is completely an extra chromosome, that is trisomy 21. So when you see the karyotype, all chromosomes are in sets of two. This 21 has three sets. That is trisomy. There is another way that Down syndrome can happen, that is that extra material is not like an extra chromosome separately, but as part of another chromosome which is a little altered in shape. So you may have total 46 chromosomes, but you may have extra 21 material on either chromosome number 14 or 21 or somewhere. So that is known as translocation Downs. So when one child has Down syndrome, it is important for us to get a chromosome analysis done for that child to distinguish whether it has a translocation Downs or a standard Downs. So if the baby has a standard Downs, then the risk of the mother having Downs in her next pregnancy is 1% more than her age related risk. And therefore, whatever screening test we use, we change the baseline accordingly. In today's day and age, there is a new test that has come that is called cell-free fetal DNA, or the NIPT, and that really works very well for women who have a previous child with Down syndrome, a standard Down syndrome, and this can be tested in the uh, mother's blood, and you can get a risk assessment, a good screening test, in addition to the scan, of course. However, if the first child has a translocation Downs, then one has to check the parents, because one of the parents is most likely carrying a balanced translocation. And then in the next pregnancy, it is mandatory to do an invasive test like a CVS or a amniocentesis, and check directly in the fetus whether the fetus has Downs or not, and also whatever other problems can come because of the translocation, because then the baby is at risk of not only Downs but other problems with that. So your answer is, if the child is diagnosed with Down syndrome, please find out if it is standard Downs or translocation Downs. And depending on that, in the next pregnancy, if you go for screening, then you change the baseline risk of the mother. If you go for diagnosis, you directly diagnose the Down syndrome. But all this is possible. So missing Down syndrome in one pregnancy is possible, but when you are definitely looking for it in the next pregnancy, I am sure you will be able to find out a reasonable prenatal diagnosis. So we have had quite a number of points that we have discussed so far, and I really feel happy that you are interacting and asking things. So if there's any other issue that is coming into your mind right now, then you may discuss that also. With my discussion with a lot of parents who are dealing with babies with Down syndrome has been that while they are very happy at home and they have developed a very positive atmosphere at home, and they have kind of adjusted their lifestyles to a child with Down syndrome, one of the problems they face is finding optimal schools and a good education system for these children. And that is where I think some cities are ahead of the others. In some places you have developmental uh, teachers who are interested in children with special needs, and they do have special centers where children with these special needs can go and receive education. But if they have to be forced to sit in a class with whatever we call as normal children, there will be a lag, and it's sometimes very stressful on the child as well as the teacher and the parents. So it is really useful if these children can find a special institution where they can go and be taught according to their baseline. So they are just different, but then they have very, very good ability to grasp certain skills which other children may not have. And their ability to do certain things is different. And if it is nurtured in that specific way, then the outcomes are very, very satisfying. So that was one thing which I always thought that, um it was unfair on the parents um, who have children with Down syndrome, where they sometimes face a bit of what can I say, a bit of discrimination in educational institutions. So, if any one of you has any experience with that or will want to share some good information to the rest of our viewers, then feel free to write in the chat box, because this is a discussion. It is not like lecture. The other important thing that I wanted to say is general approach of society to a child with special needs, because you often see children in the grocery stores or in the movie theaters or in the airports who have this condition. They look distinctly different from the others and are often chaperoned by their parent or another sibling. And there's a lot of staring and a lot of uncomfortable looks that are given to these individuals, which I feel is very I mean, it's very different in the Indian scenario and in the Western scenario. I have sometimes felt that there are some societies which are more tolerant of these differently abled people, and they accept them much better. Whereas in our society, while it's very heartening to see that a lot of us are accepting this and moving forward to make a very cohesive atmosphere for people with all kinds of abilities, there is still a little bit of that um, uncomfortable approach towards people who have different abilities. Parents feel very conscious, and many parents actually don't attend family functions, they don't attend social functions, they keep the children separately. Even when they come for consultations, I have noticed that if the first child has some problem, they are very apologetic about it, and they try to keep the child out of the consultation room because they feel it will disturb the consultation. But I think the test of the maturity of a society is how do we make them inclusive? How do we understand that that's okay? Somebody might be different, but he's still part of our society, and it's our responsibility to make them feel included and involved. So that's one aspect where I feel all of us should just stand up and accept any differences in society as part of just the variety of society, rather than saying normal or abnormal or anything differently. So that's the question there, that can children with Down syndrome attend regular schools? So yes, they can attend regular schools, but that will not be fair on them or the other children, or because children are children. So whatever I am talking to you, I'm telling you that's a test of maturity. And while maturity is expected out of everyone. You don't expect a 5-year-old to have that maturity. You don't expect a 9-year-old to have the maturity. This comes from the adults. So, yes, we are supposed to tell our children to treat children with different needs similarly and make them feel involved, but it's also imperative on us to give them different goals where they excel, because you give them the right test, they will excel. So, if you want to assess the abilities of all the animals in the jungle and the test is climbing a tree, then you know the elephant is not going to perform very well on that, because climbing a tree is not the test at which an elephant can prove its own mettle. So, you have to design a specific test for a specific individual based on his or her special abilities. So, that is where I don't think they have to be put under the pressure. Now, it's a complex situation. It's not like they can't attend normal school, but if they attend the regular school, and you know that there will be a lag in their intelligence, there will be a lag in their grasping of concepts at a particular age, it is not fair on everybody. So we must have the acknowledgement that there will be certain number of children who will be born with certain special requirements, and for them, these are the teachers who will specialize in taking care of these. Just like in medicine, we have done that. We all do our MBBS, we all do our specialization in certain subjects, but after that we subspecialize. So I did my MBBS, I did my MS in obstetrics and gynecology, but then I decided to concentrate on the fetus. And therefore, today I work in a specialty called fetal medicine. And these are the topics which I deal with on a day-to-day basis, and therefore I have a better insight into these conditions. But if you ask me today about adenomyosis or hysterectomy or something, I may not be the best person to answer that question, because that is not the area of special expertise for me. So, in school, also, in the education system, also, there has to be a division of specialities, and there have to be a set of teachers who will take up educating children with Down syndrome as a special interest. And it would be a very good provision in schools if they had a section for Down syndrome. And therefore, parents would think that it's okay. They will go to the Down syndrome section and they will achieve whatever can be achieved in that section. And believe me, there are some talents that these kids do so much better than the other. In fact, there is it's a WhatsApp forward actually, but it does do its rounds sometimes, where they have described a set of people participating in a race in the Special Olympics, in the Olympics that is done for people with special abilities. And when one contestant falls down, all of them stop and pick that person up and walk together to the finish line. That kind of camaraderie, that kind of understanding, that kind of warmth is seldom seen in other competitions where everybody wants to go in front of the other. So what we call as differently abled might be really beautifully different, or might be actually something better than what abilities we have. So for society to just judge everybody on the basis of their academic performance, on the basis of their ability to do maths or physics, may not be the right way to take things forward. So there has to be an evolution in the education system, and there has to be a method which will make life easy for parents to accept children with special abilities. One of the reasons parents feel very left out is because society sort of, discriminates, and that discrimination has to go. So the theme for the Down Syndrome Day this year is improving support systems. And when you say improving support systems, it has to be at all the levels. It has to be support systems for children with Down syndrome to grow and flourish in the society. It has to be support system for the parents to accept children with certain special needs, and not feel victimized, or not feel uncomfortable in moving in the airports and the bus stops and any public place for that matter. And it also has to be support system in improving the diagnosis and screening for Down syndrome in the medical field, so that the doctors also feel empowered that they can give this information to the patients when it makes sense and when it can make a difference in their lives. So I really hope that we move towards that, and we become a better society as the years progress. So if there's any feedback, any questions, anything that you would like to discuss, I am still looking at the chat box. So I would like to just ask you one question. If you were to take a sort of a house in some residential locality and you were told that the child next door has a special condition, or you just found out that your neighbor next door has a kid with Down syndrome, how would you respond to it? What would be your first response? Anybody who wants to just give me a feedback. What would you think? Would it be a deterrent? Would it be a reason to change your decision to take that house, or you would be okay, or you would stop your kid from interacting with their kids? It's just a thought provoking question. I just want to know how you would respond. I'm really looking forward to some response at least, but I know it's a difficult question. I know it's a difficult tone to set there, but like I said, the test of maturity of a society is when we will not treat differently abled people differently in terms of accepting them as part of our society. So I would hope that you would write that, okay, that is not going to be a deterrent, or even if it does, what exactly is going to trouble you is something that I would have wanted to discuss here. But as of now, I don't see any response in the chat box. Is there any response there? Yeah, interacting with a live audience is always so much more sort of uh, reassuring that you know whom you're speaking to and whether they're actually listening. But here I am a bit oblivious whether you're getting my message or not. But if there was a response, I would have just loved that response there. So if there are any more questions, then we would like to answer those questions. And if there are no more questions, then I would just like to wind up the session. I thank anyone and everyone who has joined, and at least the people who asked me questions. And if you listen to this webcast, at least it gives us that satisfaction of completing at least an information provision service on the occasion of the World Down Syndrome Day. It's not like we don't talk about these things on other days, but having a special day dedicated to a particular condition gives us the opportunity to address the special needs of this particular condition from all perspectives, not only from the perspective of the patients, not only from perspectives of families who've had kids affected with Down syndrome, but also from prospective parents and the healthcare providers and the doctors who face multiple dilemmas in society, education provision people, even people planning, public places, they have to think of children with special needs. And that is happening. And we are seeing a lot of changes in society onto the positive side. So we hope that we evolve into a better society. And as the theme for this year says, we definitely improve the support system for Down syndrome. With that, I think I'm going to log out. Thank you very much. If we still have any questions, I'm on for another 5 minutes or so. And if we don't, I will log out. Thank you so much. Oh, I do have a response to that. Not really. That child should not be a deterrent to us. Rather, we should encourage our children to mix with them so that our vision towards life grows bigger as a whole. Yes, this is a wonderful response, and it has come from Asit. And this, I think, is something which will really, uh, you know, uh, improve the overall view of society towards these problems. I'm very thankful to Asit for this response because it was a very, very complex situation. It is a situation where you don't know how to respond to it. And I do see a lot of reluctance in parents who have children with special needs, like autism, like Down syndrome, to take their kids to family functions because they feel the others think it's a jinx to meet with them. There are a lot of myths, there are a lot of superstitions, there are a lot of social constructs which deter us from behaving in a rational manner. So it's very, very heartening to see that Asit has written that you know he will not get deterred with that information. Rather, he would encourage his children to interact with that child and understand that it takes a lot of different type of people to form society, and each person has his or her role in society. Thank you so much, Asit. So, Shalini has also written that would do my best to educate and give reassurance to the parents first. Absolutely. So, what I think we are understanding this, the group that has joined us, this thing. Oh, thank you so much. I got one more response which says, "What is the life expectancy of individuals with Down syndrome?" Yeah, so the life expectancy of individuals with Down syndrome, unfortunately, is a little less than the rest of us. But if they do not have any, the children who have major structural abnormalities may live for few years. But if they have no structural abnormalities and if their medical conditions are managed properly, then people with Down syndrome have reached up to 40, 50 years of age. We also have reports of individuals with Down syndrome who have taken up jobs, who have got married, and we also had one report once where they had their own children. So it is possible for them to have a reasonably normal life in society if they do not have any major structural abnormalities and if proper medical care is given to them. So the life expectancy can go up to 4 or 5 decades of life with Down syndrome if they are really lucky so as to have the right structure and the right environment around them. Some of them who have other problems, and like I said, there is predisposition to childhood malignancies, to congenital malformations, sometimes don't make it past childhood, but in few cases they do go up to fourth or fifth decades of life. No, thank you so much for those responses because, like I said, when you don't have the audience right in front of you, you are not sure how much you are reaching to. But I would really thank all the people who have responded and interacted because it made the whole exercise very satisfying. So, like I said, I'm Dr. Chinmayee, a fetal medicine practitioner in Hyderabad, and I work at the Kim Sunshine Hospital's Begumpet. Our center is known as the Resolution Center of Fetal Medicine, and the contact details will all be given there. If you ever want to contact us, please feel free for any of your problems. And I would like to connect off and on with you with topics of relevance in fetal medicine and hope to improve the general awareness and the social acceptability of fetal problems. Thank you so much.